If you are over 60 and you have been prescribed metformin, or your doctor is thinking about putting you on it, I need you to watch this video before you take another tablet. Because what I am about to share with you today is something most doctors genuinely do not have the time to tell you, and that is not me attacking your doctor. Your doctor may be a wonderful person, but the average consultation lasts less than 10 minutes. And metformin is a drug that deserves far more than 10 minutes of your time. My name is Dr. Joseph Collins, and I am a medical health educator. I have spent years helping people over 60 understand what is happening inside their bodies, in plain language, without the confusion, without the rushed explanations, and without anything being left out. Today I'm going to tell you what metformin actually does inside your body. I am going to tell you what can go wrong, how to protect yourself if it does, and what your real options are, including options most people in your position have never even been told exist. So stay with me, because by the end of this video you are going to have something incredibly valuable, a clear picture of this medication, what it means for your health, and how to make an informed decision about it. That is something you deserve. Let us start at the very beginning, because before we can talk about metformin, we need to talk about why blood sugar becomes a problem in the first place. When you eat, whether it is bread, rice, yam, or even a ripe banana, your body breaks that food down into glucose. Glucose is the fuel your body runs on. It goes into your blood, and your blood carries it to every organ, every muscle, every cell that needs energy. Now, your body cannot just leave glucose floating around in your blood indefinitely. High levels of glucose in the blood are dangerous. So your pancreas, a small organ that sits behind your stomach, releases a hormone called insulin. Think of insulin as a key, and your cells have locks on their doors. Insulin knocks on those doors, the cells open up, they take in the glucose, and your blood sugar comes back down to a safe level. That is the system working exactly as it should. But here is where things begin to go wrong for many people, especially as we get older. Over time, with years of eating, with gradual weight gain, with the natural changes that come with age, your cells start to fill up. They become, in a sense, overwhelmed. So when insulin comes along and knocks on those doors, the cells do not respond the way they should. They resist. They stay closed. Doctors call this insulin resistance. When your cells stop responding properly to insulin, the glucose that should be going into your cells stays in your blood instead, and your blood sugar begins to climb. Now your pancreas sees this happening, and it tries to compensate. It produces more insulin. It works harder and harder to force those cells to respond. And for a while it manages, but eventually, after years of overwork, your pancreas cannot keep up anymore. That is when your blood sugar rises high enough to show up on a blood test. That is when your doctor says the words you never wanted to hear, prediabetes or type 2 diabetes. And what is deeply important for you to understand is this: that whole process, from the first sign of insulin resistance to the diagnosis, has often been going on quietly inside your body for 10, 15, sometimes 20 years, with no obvious warning, no alarm going off. Now here is something that many people dismiss, and I want you to take this seriously. High blood sugar does not just mean a number on a test. When glucose stays elevated in your blood for too long, it begins to cause damage. It affects the tiny blood vessels in your eyes. And this is one of the leading causes of vision loss in older adults. It damages the nerves in your feet and hands, causing the burning, tingling sensation that many people assume is simply part of getting older. It slows down wound healing, which is why a small cut or sore on the foot of someone with uncontrolled diabetes can become a serious problem. It affects your kidneys, it affects your heart, it affects your energy levels, your sleep, your ability to fight off infections. And yes, it affects sexual function as well. That is a conversation most doctors skip over entirely. The point is this: if your blood sugar is high and nothing is done about it, your body pays a real price, in real organs, over real time. So when your doctor prescribes metformin, they are not being dramatic. They are trying to stop that damage before it starts, or slow it down before it gets worse. But here is the part that brings most people to a video like this one. Metformin is the most widely prescribed diabetes medication in the world. Hundreds of millions of people take it. And yet, most of them were handed a prescription and sent home without a proper explanation of what the drug actually does, what side effects are possible, or what they should watch out for. That stops today. So now you understand what is happening in your body when blood sugar climbs too high. You understand insulin resistance. You understand why your doctor reached for the prescription pad. Now let us talk about metformin itself. Metformin has been around for decades. It is not a new drug. It is not experimental. And the reason it has remained the first choice for type 2 diabetes management for so long is because for most people, it works in several important ways simultaneously. First, metformin goes to your liver. Your liver is actually responsible for releasing stored glucose into your blood, even when you have not eaten. In someone with insulin resistance, the liver tends to release far too much glucose, adding to an already elevated blood sugar level. Metformin significantly reduces this excess release. It essentially tells your liver to calm down and stop flooding your blood with sugar it does not need. Second, metformin helps your muscle cells become more responsive to insulin again. Remember those locked doors we talked about? Metformin helps nudge them open. It does not force them. It helps restore their sensitivity, so that when insulin knocks, the cells are more willing to respond. Third, it slows down how quickly your intestines absorb sugar from the food you eat. So after a meal, instead of a sharp spike in blood sugar, the rise is slower and more manageable. Together, these three actions lower your blood sugar without forcing it dangerously low. And that is an important distinction. Because some diabetes medications work by pushing your pancreas to produce more and more insulin, which can cause your blood sugar to drop too low. Metformin does not do that. It works with your body's existing system rather than overriding it. There are other advantages worth knowing. Metformin is among the least expensive diabetes medications available. You can find it in almost every pharmacy in the world. It comes in tablet form, 500 milligrams, 850 milligrams, and 1000 milligrams, so there are no injections involved. Some people even experience modest weight loss while taking it, which is notable because several other diabetes drugs actually cause weight gain, making the underlying problem worse over time. There is also a growing body of research, and I want to be careful to present this accurately, suggesting that metformin may have protective effects that go beyond blood sugar. Studies, including research published as far back as 2005, began showing associations between metformin use and reduced rates of certain cancers among diabetic patients. As of recent years, over 300 clinical trials have explored this angle. The science is still developing, and I am not telling you metformin is a cancer cure. It is not. But the possibility that this medication may offer broader cellular protection is genuine, and it is being taken seriously by researchers worldwide. That is something your doctor almost certainly did not mention during your 10-minute appointment. Now, let us have the honest conversation, because metformin also has a side that many patients only discover after they have already started taking it, and discovering it alone, without any warning, is one of the main reasons people stop taking the medication before it has a chance to help them. The most common side effects of metformin are digestive: nausea, stomach cramps, bloating, gas, and for a significant number of people, diarrhea. Not mild discomfort. For some people, it is severe enough that they become afraid to leave their home, afraid to attend church, afraid to travel, afraid to visit family. I have heard this from patients more times than I can count, and it is completely understandable. Up to half of all people who start metformin experience some degree of digestive disruption. That number deserves to be said plainly, because it is rarely said at all. Some people also notice an unusual taste in the mouth, metallic or slightly sour. Some experience general fatigue and muscle aching that they may not immediately connect to the medication. And in older adults specifically, metformin can cause a drop in blood pressure when you stand up quickly, that sudden dizziness when you rise from a chair. For someone over 60 who already has any issue with balance, that is not a small thing. That is a falls risk. And falls, as you may know, are one of the most serious health threats for adults in your age group. There is also a rare but serious condition called lactic acidosis, a dangerous buildup of a substance called lactic acid in the blood. It is uncommon, but it is more likely in people who have kidney problems, who are taking high doses of metformin, or who drink alcohol regularly. The warning signs include extreme tiredness, muscle pain, difficulty breathing, and confusion. If you ever experience these together while on metformin, do not wait. Seek medical attention immediately. But here is the side effect I want you to pay particular attention to, because it is the one most consistently overlooked by doctors and patients alike. Metformin interferes with how your body absorbs vitamin B12 from food. Over time, sometimes over years, this can lead to B12 deficiency. And the reason this matters so much is that B12 deficiency causes nerve damage. It causes the very same tingling, numbness and weakness in the hands and feet that diabetes itself causes. So here is what can happen without anyone realizing it. A person takes metformin for several years. They develop B12 deficiency. They develop nerve symptoms. Their doctor assumes it is diabetic neuropathy, nerve damage from the diabetes, and treats it as such. But the real cause, or at least a contributing cause, is the metformin quietly depleting their B12 levels. This is not a reason to stop taking metformin. It is a reason to ask your doctor to check your B12 levels, ideally once a year. A simple blood test, and if your levels are low, a B12 supplement can correct it. It is manageable, but only if you know to look for it. Now, if you are wondering whether there are ways to take metformin with fewer side effects, there are. And I'm going to cover those, along with your real alternatives, in the final part of this video. But before I do, I want you to do one thing right now. If you are currently taking metformin and you have been experiencing any unexplained fatigue, nerve symptoms, or digestive problems, write those symptoms down. Write down when they started. Bring that list to your next appointment. You deserve to have that conversation with your doctor. And now you have the language to have it. We have covered a lot of ground together in this video. You now understand why blood sugar becomes a problem in the first place. You understand what metformin actually does inside your body. And you understand the side effects that most people discover alone, without any warning. Now, I want to give you something practical, something you can actually use, because information without direction is not truly helpful. So in this final part, I am going to walk you through 3 things: how to take metformin in a way that reduces your risk of side effects, what your real alternatives are if metformin is not working for you, and the bigger picture that most diabetes videos never address at all. Let us start with side effect management, because the truth is, many people who stop taking metformin do so unnecessarily, not because the drug cannot work for them, but because nobody told them how to start it properly. The single most important thing you can do when beginning metformin is start low and go slow. Most doctors will prescribe 500 milligrams once a day to begin with. Take it with your evening meal, not before, not on an empty stomach, but during or just after eating. Food slows down how quickly metformin enters your system, and that significantly reduces the nausea and stomach discomfort. Taking it at night also means that if you do feel any discomfort in the first hour, you may simply sleep through it. After 1 week, assuming you have tolerated that dose reasonably well, you can discuss with your doctor adding a morning dose as well. Then, over the following weeks, the dose is increased gradually until you reach the level your doctor has recommended. This stepwise approach gives your digestive system time to adjust. Many people who tried metformin and gave up on it years ago actually abandoned it during that difficult first week and before their body had any chance to adapt. There is also an extended release version of metformin, sometimes called Metformin XR or slow release metformin. Instead of releasing all at once into your system, it releases gradually over several hours. This produces far fewer digestive side effects for many people. If you have struggled with the standard form, this is absolutely worth discussing with your doctor. It is the same medication, just delivered more gently. And remember what we discussed in part 2, have your vitamin B12 checked. Once a year is sufficient. It is a simple addition to your routine blood work, and it protects you from a complication that is entirely preventable. Now let us talk about alternatives, because metformin is not your only option, and knowing that changes everything. The first alternative is not a supplement or a medication, it is lifestyle. I know that word can feel overwhelming, especially if you have heard it for years without real guidance. But the evidence here is genuinely powerful. Studies have shown that in the early stages of type 2 diabetes and prediabetes, reducing refined carbohydrates, bread, white rice, sugary drinks, heavily processed foods, along with consistent gentle movement, can lower blood sugar to a meaningful degree. Not for everyone, not in every case, but for many people, especially those who catch the problem early, lifestyle change is not just supportive, it can be transformative. The second alternative worth knowing about is berberine. Berberine is a natural compound found in several plants, and it has been studied extensively for its effect on blood sugar. It works through a similar cellular pathway to metformin, activating an enzyme that helps your body manage glucose more efficiently. Multiple studies have shown that berberine can produce blood sugar reductions comparable to metformin in some patients. It also tends to cause fewer digestive side effects for most people, though it is not entirely without them. The typical dose used in studies is 500 milligrams, 2 to 3 times daily, taken with meals. It is not a prescription drug, but it is not a casual supplement either. Discuss it with your doctor before starting, especially if you are already on other medications. There is also a more absorbable form called dihydroberberine, sometimes called DHB, which your body processes more efficiently, meaning you may need a lower dose to achieve a similar effect with even less digestive disruption. Other natural compounds that have shown promise in research include inositol, which helps improve insulin sensitivity, fenugreek, which slows the absorption of sugar after meals, and gymnema, which may reduce sugar absorption in the intestines and help curb sugar cravings. Each of these has a body of research behind it. Modest but real. None of them should replace a conversation with your doctor, but all of them are legitimate options worth raising. Now I want to share something with you that goes beyond any pill or supplement, because this is the part of the conversation that almost never happens in a doctor's office, and it is the most important part. When your blood sugar is high and your cells are resisting insulin, your body is sending you a message. It is not a malfunction. It is a response. Your cells have taken in more fuel than they can comfortably handle for years, and they are protecting themselves by refusing to take in more. Metformin can help manage that situation. It can bring your numbers down and protect your organs while you work on the deeper issue. But metformin does not fix the underlying cause. When people stop taking it, their blood sugar rises again because the root condition has not been addressed. Think of it this way. If water was leaking through your ceiling every time it rained, you could put a bucket on the floor to catch the water. That bucket is doing an important job. It is protecting your floor. But the leak is still there, the roof still needs attention. Metformin is the bucket, a necessary, valuable bucket. But your long-term health depends on also addressing the roof. The path to doing that, reducing insulin resistance at its source, involves the food you eat, the quality of your sleep, your stress levels, and consistent movement, not extreme measures, not punishment. Small, steady, sustainable changes that your body can actually respond to over time. So here is what I want you to leave this video with. If you are taking metformin, take it correctly. With food, starting low. Monitor your B12, know the warning signs, and if the side effects have been difficult, ask specifically about the extended release version. If you are considering alternatives, berberine is the most studied natural option. Lifestyle change is the most powerful. Neither replaces medical supervision. And if you want to genuinely address the root cause of insulin resistance, that conversation is coming. Because in our next video, I'm going to walk you through exactly what happens when you begin to reverse insulin resistance. What changes in your body, how long it realistically takes, and the specific steps that the research actually supports. If you found this video helpful, please share it with someone you care about who is managing their blood sugar, because the information in this video is the conversation that should be happening in every doctor's office. And too often it simply is not. I am Dr. Joseph Collins. Take care of yourself, and I will see you in the next one.